Hello friends, this is your Mohan Rao Addi. Today we will talk about anti-tubercular drugs. So before going the anti-tubercular drugs, first we'll see what is the tuberculosis. The tuberculosis is a contagious disease. What is the contagious disease? The meaning of contagious disease, it spread from the one person to the other person, right? Spread from one person to other. So that is the contagious disease. So it is mainly transmitted through the sputum, sneezing. This is the major ways, that is the sputum and sneezing. Here, what is the causative organism for the TB? The causative organism for the TB, normally Mycobacterium species causes the tuberculosis. What are the Mycobacterium species causes the tuberculosis? That is, you can remember with tab with cam. Tab with cam, that is the code word. What is the T? The T stands for Mycobacterium tuberculi. Mycobacterium tuberculi. This is the one of the major causative organism for the TB. A stands for Mycobacterium avium, and B indicates here bovis, Mycobacterium bovis. K stands for Mycobacterium cannasi, and here one more A is there, that is Mycobacterium africanum, right? And the last M, Mycobacterium maranim. So these are the 6 causative agents are there for TB. Among all these 6 causative agents, the major 2 causative organisms are for TB is, one is Mycobacterium tuberculi, another one is Mycobacterium avium. These are the 2 major causative organisms which causes the TB. So here, if you look at the Mycobacterium organism, in the prefix what is there? Myco plus bacteria. What is the myco plus bacteria? We know everyone, this bacteria cell wall contains the mycolic acid. That's why this bacteria we call it as Mycobacterium, right? Mycobacterium, the name itself tells the information regarding cell wall. The Mycobacterium cell wall is made up of mycolic acid. Cell wall is made up of mycolic acid. That is what Mycobacterium. And here the Mycobacterium tuberculi, it is acid fast bacteria and also aerobic bacteria. What is the aerobic bacteria? It is grows in the presence of oxygen. That's why we say it as this is the aerobic bacteria. Mycobacterium, wherever the oxygen is there, so that in that presence of oxygen it will grow. We know in the human body oxygen related organ is lungs. That means it is initially attacks on the lungs. That is what it means. Mycobacterium tubercular organism initially attacks the lungs because it requires the oxygen for their growth. Later reaches the lymph nodes. So Mycobacterium tubercular organism first attacking on the lungs, then reaches the lymph nodes via bloodstream. Via what is that? Bloodstream. So here there is a one technical term, that is transfer of disease from one location to other location of body called, what we called, dissemination. Here Mycobacterium tubercular initially attacking on the lungs, right? Then later reaches the lymph nodes, isn't it? So here the disease location transferred from the lungs to the lymph nodes. This is only we call it as dissemination. What we called? Dissemination. Transfer of disease location from the one place to the another place, that's what we call dissemination. What we are seeing till now? We are seeing about the tuberculosis. The tuberculosis is the contagious disease we are saying. It is spread from the one person to others. It is majorly transmitted through the sputum and sneezing. And what kind of mycobacterium this one? It is a acid fast and aerobic bacteria. It always grows in the presence of oxygen. For their growth required the oxygen. That is the what? Reason why mycobacterium organism attacks on the lungs. Initially, why it attacks on the lungs? Because it requires the oxygen for their survival purpose. So that is the reason Mycobacterium tubercular organism initially attacks the lungs, later reaches the lymph nodes. This process only we call it as dissemination. Clear everyone? Now moving forward, some bacilli will undergoes the resting or dormant stage. Here some bacilli will undergo resting or dormant stage, that is inactivate state of bacilli. Some bacilli, not all bacilli. So this bacilli generally reactivate after 4 to 8 weeks, reactivate after 4 to 8 weeks. After reactivated, this organism affects other regions like kidney, adrenal medulla and meninges. First initially attacked on the lungs, later lymph nodes. It is some bacilli undergoes the resting stage or the dormant stage. After that it will get reactivate after 4 to 8 weeks. Then it attacks on the different regions of the body, majorly attacks on the kidney, yes, after adrenal medulla, and meninges. When organism attacking on the kidney, what will happen? We will get the urinary bladder problems. When the organism attacking on the adrenal medulla helpful for the synthesis of adrenaline. So when the organism attacking on the adrenal medulla, automatically adrenal synthesis what will happen? Yes, right? It decreases the adrenaline synthesis. Meninges, you will get the CNS disorder. Now if you can see the tuberculosis types, there are the two types of tuberculosis. What is that? One segment is initially attacking on the lungs. Lungs means it is a respiratory system. It is a respiratory system. The respiratory system we also call it as the pulmonary system. So initially it is attacking on the lungs. So that's why this first stage of TB we call it as pulmonary TB. Can I say pulmonary TB? Yes, I can say that pulmonary TB. The tuberculosis is, one is pulmonary TB. What is the pulmonary TB? Organism affects on the lungs, that is the pulmonary TB. It affects lungs. The second type of TB is extrapulmonary TB. What is the meaning of extrapulmonary TB? Other than pulmonary system means other than lungs, it attacks on the other regions of the body. That's we say it as the extrapulmonary TB. affects other organs. So this is the two types of TB. Now pulmonary TB to the extrapulmonary TB. Transfer of disease location from the one place to the another place is happening. Initially lungs, later other body parts. That transfer of disease locations, what we say? Just now we discuss, right? That is dissemination. What do we call that one? Dissemination. Normally extrapulmonary TB is mainly associated with HIV patients. The extrapulmonary TB associated with HIV patients. Right? There is a one more TB, that is severe form of TB. That means it is the last stage of TB. That last stage of TB we call it as miliary TB. What is the another name we are saying here? Miliary TB. Miliary TB means what? It is a severe form of the TB. Means entire body it will get affected. So it is a less chances of the patient surviving. That is the miliary TB. Clear everyone? So that is the, what is the TB? What are the types of the TB? What are the causative organisms? Till now we discuss. The moving forward, we will talk about diagnosis test. The major diagnosis test here, diagnosis, one is tuberculin test. Tuberculin test. The tuberculin test we also call it as, what we call, Montauk's test. The another one we can diagnose by using the radiography. So these are the best two methods we can detect the tuberculosis. Done. The next one, what are the drugs we used for the treatment of tuberculosis? So the drugs used for the treatment of TB, it is classified into two types. One is first line agents, another one is second line agents. First line agents, another one is second line agents. What are the first line agents are there? Yes, how to remember the first line agents? Very simple. The first line agents are, you can remember the code word, that is price. If you remember the price means, you know the first line agents. The P stands for pyrazinamide, R stands for rifampicin, I indicates here isoniazid, and S streptomycin, E ethambutol. These are the first line anti-tubercular agents. What is the code word here given? Price. P pyrazinamide, R rifampicin, I isoniazid, S streptomycin, E ethambutol. If you observe the first line agents, there are the two antibiotics there. What is that antibiotics? Rifampicin is the one antibiotic and streptomycin is the another antibiotic, right? So rifampicin, streptomycin, we call it as first line antibiotic. First line antibiotics. What are the first line antibiotics? Rifampicin and streptomycin. Now we will see the first initial drug in the first line agent, that is isoniazid. Now keep the heading isoniazid. You can see the name of isoniazid, right? What is there here? Iso is there, nia is there, and jid is there. What is the meaning of iso? Iso means same. We will study in that isomerism concept, iso plus meros. How the isomerism name it comes? Iso plus meros. Iso means same, meros means equal parts. Here also iso means, wherever you will get the term iso, that indicates the same, like quinoline and isoquinoline. What is that difference? Just position of the nitrogen is different. Rest of the things are the same. That's why we say it as the same. Iso means same. And another term here we have, that is another part, NIA. What is the NIA? Nicotinic acid. Nicotinic acid. Nicotinic acid. Isonicotinic acid. And the last part, ZID. The ZID indicates hydrazide. If you look at the hydrazide name, in the hydrazide, what is there? ZID is there. Yes. So, isonicotinic acid hydrazide, what we called? Isoniazid. The simple way, INH. What is the INH? Isonicotinic acid hydrazide. कुछ मगअप करने के लिए जरूरत नहीं इधर. Isonicotinic acid hydrazide, that is isoniazid. Now, before knowing the isonicotinic acid, you should know what is the nicotinic acid. What is the nicotinic acid? The pyridine, isn't it? This is the pyridine and carboxylic acid. This pyridine carboxylic acid, we call it as nicotinic acid. We call it as nicotinic acid, right? So, the similar way, everyone knows quinoline and isoquinoline. Do you remember quinoline and isoquinoline? What is the structural difference of quinoline and isoquinoline? Right? I am writing here. The quinoline, benzpyridine. This is the quinoline. What is the isoquinoline? Everything is the same. Everything is the same. But here, position of the nitrogen is what happened? Here the nitrogen is there in the quinoline condition, but in the isoquinoline condition, position of nitrogen is present here. That's why the name we have given iso. Iso means same. Quinoline, isoquinoline. It is the same structure. Only difference is position of nitrogen. That is the reference. Here also we have the nicotinic acid and isonicotinic acid. What is the difference? Right? Nicotinic acid, that is the carboxylic acid, position only will differs. This is the nicotinic acid. Now isonicotinic acid. This is the isonicotinic acid. What is the difference between the nicotinic acid and isonicotinic acid? Exactly, carboxylic acid position. If you look at the carboxylic acid position, here 1, 2, 3. Third position you have the carboxylic acid. So this is, can I call it as the pyridine? Pyridine, 3 carboxylic acid. Pyridine, 3 carboxylic acid. Come to the isonicotinic acid, 1, 2, 3, 4. What is that? Pyridine, 4 carboxylic acid. Just position of the nitrogen is different. Now, in the nicotinic acid, we have written the isonicotinic acid. Now, what we want to write here? ZID. What is the ZID? That is the hydrazide. We have the hydrazine. What is the structure of hydrazine? NH2, NH2. So, NH2, NH2 we call it as the hydrazine. From the hydrazine, if you remove the one hydrogen, from the hydrazine, if you remove the one hydrogen, then you will get the what? Hydrazide. What you will get? Hydrazide. Now we know that isonicotinic acid, we know the hydrazide. So take the isonicotinic acid and take the hydrazide. fuse it together, then you will get the structure of isonicotinic acid hydrazide, isoniazid. See how I am writing? Right? NH, NH2. This is the what structure of INH. Another way you can write, sir, how you have written this structure? Very simple. I have taken the initially isonicotinic acid. What is there in the isonicotinic acid? This is that pyridine 4-carboxylic acid. And I have taken the hydrazine. Can I write the hydrazine like this? NH2, NH2, NHH, NH2. The same only. Nothing is changing here. And you can remove this minus H2O. Then what you will get? Isonicotinic acid, C double bond O, this part. Here OH is eliminated, here hydrogen is eliminated. Rest of the things NH, NH2. This is the structure of isonicotinic acid hydrazide. Is it easy? This is the isoniazid. In this isoniazid, if I removed the S, I just removed the S. Instead of the S, I placed the P. Then what I will get the name? Iproniazid. What is this? Iproniazid. Isoniazid, derivative only iproniazid. Here what is that? Here isonicotinic acid is there. Here ipro. Pro means what? Propyl. What is there in the prefix of pro? Propyl. That is the I means iso. Isopropyl nicotinic acid hydrazide. Isopropyl nicotinic acid hydrazide. That is the iproniazid. It is so simple. But iproniazid having the antidepressant activity. Antidepressant activity. It is majorly inhibits the MAO enzyme. So if the drug inhibiting the MAO enzyme means we can use it for the treatment of depression, right? Depression को use कर सकता है. Isoniazid. Isoniazid is the anti-tubercular agent. Clear everyone? Now come to the isoniazid mechanism of action. What is the INH mechanism? The INH, it is the prodrug. It is the prodrug. Pro means what? Before. Before taking the drug, it is an inactive form. Once you take inside the body, the drug will get converted to active form. That is what meaning of prodrug. Pro means before. Before taking the drug, it is an inactive form. Once you take inside the body, it will get converted to active form. Same, INH is the prodrug. So what is that INH? Active form. The INH active form is, anyone? What is the active form INH? Correct. Isonicotinyl hydroperoxide. So this is the active form of isoniazid, isonicotinyl hydroperoxide. Clear? So this isonicotinyl hydroperoxide is the active form, and this active form inhibits the mycolic acid synthesis. Inhibits the mycolic acid synthesis. We know that Mycobacterium tuberculosis organism cell wall is made up of Mycobacterium tuberculosis organism cell wall is made up of mycolic acid. Cell wall is made up of what? Mycolic acid. Now there is no cell wall. We are trying to inhibit the cell wall only. When we inhibited the cell wall, automatically the osmotic pressure is not going to maintain the cell organelles. When the osmotic pressure is not maintaining the cell organelles, the organism growth will be inhibited. That is what mechanism of action of isoniazid. It inhibits the mycolic acid synthesis. So, how it inhibits the mycolic acid synthesis? That is what now question mark. It directly inhibits the synthesis, or else is there any enzyme involved in the mycolic acid synthesis? There is a one enzyme involved in the mycolic acid synthesis. That enzyme name is enoyl acyl carrier protein reductase. Enoyl acyl carrier protein reductase. So, enoyl acyl carrier protein reductase majorly involved in the synthesis of mycolic acid. It is this enzyme helpful for the synthesis of mycolic acid. Correct? Now, our drug INH inhibits this enzyme. When we inhibit this enzyme, that is the enoyl acyl carrier protein reductase, is it possible to synthesize the mycolic acid? No, we can't synthesize the mycolic acid because this enzyme is necessary for the synthesis of the mycolic acid. So, ultimately mycolic acid synthesis is inhibited and the organism growth is inhibited. That is what mechanism of action of isoniazid. Done everyone? So, we have one point, that is the active form of isoniazid is isonicotinyl hydroperoxide. How the isoniazid to isonicotinyl hydroperoxide conversion happened? With the help of what? INH converted to their active form, that is isonicotinyl hydroperoxide, in the presence of catalase. What is that enzyme? Catalase peroxidase. Catalase peroxidase is an enzyme helpful for the conversion of INH to isonicotinyl hydroperoxide. Everyone clear regarding this one? So, that is the mechanism of action of INH. Come to the pharmacokinetic of isoniazid. Right? The pharmacokinetic. So, here what is there? Pharmacokinetic. Co means what? Combination. Kinetic means what? Always we study kinetics with respect to the time. That is what kinetics. And pharma means what? Our drug. You can say our dosage form. Whatever you can take, drug or dosage form meaning. So, how our drug is acting inside the body. Right? That is the with respect to the time. That is the meaning of pharmacokinetic. Isoniazid is orally active, but should not be administered with food, specifically the aluminum containing antacids. What happened if you administered with the food or aluminum containing antacids? What will happen? Absorption decreases. Why the absorption decreases? We know that our food contains the carbohydrate. The carbohydrate, what it contains? Carbonyl group. Carbohydrates, what it contains? Carbonyl group. This is present in the food. Carbohydrates in food. Now what we have? Isoniazid, hydrazide we have in the isoniazid. NHNH2. This is NHNH2 of isoniazid. The both react together and it forms the hydrazone. What it forms? Hydrazone. This hydrazone decreases the absorption. this hydrazone decreases the absorption. That is why should not be administered with food. What about aluminum? We know about the aluminum. In the organic chemistry we studies aluminum having the vacant orbitals, the electrophilic character. So Al plus 3. So aluminum, in the aluminum Al plus 3, that is the electrophilic character, it requires the electrons. It requires the electron. Nitrogen having the lone pair of electron. Now both reacts together. When both reacts together and it forms the complex, and this complex decreases the absorption. This is the reason why isoniazid should not be administered with food, specifically the aluminum containing antacids. We will study in the organic chemistry dibol H, diisobutyl aluminum hydride reaction. In that what we did, the aluminum is the having the vacant orbitals, right? Two vacant orbitals are there. That is the electron deficient is there. That is what orbitals are the vacant. Electrophilic character, electron deficiency. So we requires the electron. Our hydrazine having the electron. The both react together and forms the complex. Automatically absorption decreases. So what is advice you are going to give when isoniazid is going to take? The advice is isoniazid should be taken, it should be taken in empty stomach. It should be taken in empty stomach. Then there is no effect on absorption. Clear? The next thing, distribution. INH distributed throughout the body. Throughout the body. It is majorly concentrated in the CSF. What is the CSF? Cerebrospinal fluid. It is distributed in the cerebrospinal fluid. That's why we can use it for the treatment of extrapulmonary TB. We can also say it as secondary TB. The pulmonary TB, we can call it as a primary TB because initially it is attacking. Initial means primary. Initially attacking on the lungs, it is a primary TB. Later it is attacking on the other body parts. So that's what we say it as the secondary TB or extrapulmonary TB. So INH distributed throughout the body and it is more concentrated in the CSF. That's why this drug we can use it for the treatment of secondary TB. Secondary TB, right? कौन सा drug use कर सकता है? INH. Clear? The next one, after distribution, metabolism. Metabolism. Isoniazid undergoes the metabolism, that is N-acetylation. N-acetylation. What is the meaning of N-acetylation? That means acetyl group we are adding on the nitrogen, that is the N. That is what we call it as the N-acetylation. Other than isoniazid, some of the drugs undergoes the N-acetylation. The code word is, remember, SHIP. What is the code word? SHIP. S-H-I-P. The S stands for sulfonamides, including dapsone. H is hydrolazine, right? Hydrolazine is the vasodilator. Sulfonamides are the antibacterial agents. I is isoniazid and here P is pyrazinamide. So these are the drugs undergoes the N-acetylation. So what is the common feature of these all drugs? These all drugs contain is the nitrogen. If the nitrogen is there, then only we can do the acetylation on the nitrogen. If the nitrogen is not there, then how can you do the N-acetylation? It is not possible. What are the drugs undergoes the N-acetylation? SHIP. Here isoniazid undergoes the N-acetylation metabolism. N-acetylation metabolism. Here catalyzed enzyme is N-acetyl transferase. N-acetyl transferase. That is the NAT. N-acetyl transferase is an enzyme which catalyzes the isoniazid. Let's take the drug. This is the isoniazid. This is the isoniazid. In the presence of N-acetyl transferase, what it gives? N-acetyl INH. N-acetyl INH. What is the acetyl? INH you know. What is the acetyl? We know the basic organic chemistry. CH3COOH is the what? Acetic acid. Acetic acid, right? And from the acetic acid, if you remove the hydrogen, then what you will get? CH3COO. What is the CH3COO? Acetate. Acetate. This group we are adding. This is the what? Acetate. And CH3CO. From CH3COO, you removed oxygen. After removed the oxygen, what you got? CH3CO. This is what we call acetyl. This is the original acetyl. Now, this acetyl group we are adding on the INH and we will get the metabolite, that is the N-acetyl INH. What is that N-acetyl INH? This is the structure of INH. Now, in the presence of N-acetyl transferase, so what we are getting? N-acetyl isoniazid. This is the pyridine. What is this one? C double bond O. NH, NH, one of the hydrogen in the isoniazid replaced with C double bond O CH3. So, C double bond O CH3 what we called? Acetyl, right? C double bond O CH3 what we call? Acetyl. That acetyl group we added here. See, C double bond O CH3. Where we added? On the nitrogen. So, that is the N-acetylation. So, the metabolite name we called N-acetyl INH. N-acetyl INH. So, this N-acetyl INH, further it gives the metabolite, that is N-acetyl hydrazide. N-acetyl hydrazide. This is the further metabolite. So, this N-acetyl hydrazide, how can you write the N-acetyl hydrazide structure? N-acetyl, that means C double bond O CH3 is there. Where it is there? On the nitrogen, right? What is this? Hydrazide. Hydrazide means we know. This is the N-acetyl hydrazide. Clear? This is the acetyl. On the nitrogen, this is the hydrazide. NH to NH is the what? Hydrazide. From the hydrazine, NH2 is the hydrazine. From the hydrazine, if you remove the one hydrogen, then you will get the hydrazide. What you will get? Hydrazide you will get. Everyone done here? Good. Now, this N-acetyl hydrazide interact with the liver proteins and causes the hepatotoxicity. Causes the hepatotoxicity. The side effect of INH is hepatotoxicity. The MCQ can come here. Which of the following metabolite of INH causes the hepatotoxicity? Your answer will be N-acetyl hydrazide. What is the answer? N-acetyl hydrazide. So this is the toxicity of INH. And INH decreases the vitamin B6 levels, that is the pyridoxine levels. When we take the INH, automatically it decreases the pyridoxine levels, vitamin B6 level. Due to this one, we will get the peripheral neuritis. What you will get? Peripheral neuritis. That is the side effect. That means whenever you take the INH, along with INH, the patient should take vitamin B6 supplement, then you don't get this side effect, peripheral neuritis. Yes, here are the two side effects we discuss. One is the hepatotoxicity, another one is the peripheral neuritis. The hepatotoxicity is due to N-acetyl hydrazide and peripheral neuritis due to decreasing the vitamin B6 levels. Understand everyone? Any doubts here? Here the two things are involved. Generally metabolism, N-acetylation metabolism is determined two ways. One is the slow acetylators, another one is the fast acetylators. Slow acetylators metabolism is determined two ways: slow acetylators, fast acetylators. What is the slow acetylators? In the slow acetylators, means the less NAT, that is the N-acetyl transferase enzyme. When you have the less N-acetyl transferase enzyme, means the formation of metabolite, that is N-acetyl hydrazide, will be less. NAT is what they are doing. NAT, what is the role of NAT? Look at here, we had discussed already. Right, this is the NAT. So NAT catalyzing the INH and giving the N-acetyl hydrazide. Now in the slow acetylators, NAT levels are less. When the NAT levels are low, then can we get the N-acetyl hydrazide? No, we don't get the N-acetyl hydrazide. So in terms of the toxicity of liver is less. The hepatotoxicity is the less in the slow acetylators. Clear? Come to the fast acetylators. In the fast acetylators, NAT levels are more. NAT levels are more. When we have the more NAT levels means, right? When we have the more NAT levels means, what happened? What happened? The N-acetyl hydrazide formation will be more. When the N-acetyl hydrazide formation is the more, you will get the more hepatotoxicity. Very simple here. Slow acetylators, NAT levels are less. When the NAT levels are less, so hepatotoxicity is less. In the fast acetylators, NAT levels are more, hepatotoxicity is the more. That is what the concept. But in the slow acetylators, NAT levels are less, so the drug undergoing the metabolism is the less. That means the INH free drug concentration is the more. So when the INH accumulation is the more in the body, automatically vitamin B6 levels will decreases. Due to decreasing the vitamin B6 levels, what you will get side effect? Right, peripheral neuritis. What you will get the side effect? Peripheral neuritis. The simple way, slow acetylators causes the side effect peripheral neuritis and fast acetylators causes the side effect hepatotoxicity. That is the two types of acetylators, slow and fast acetylators. Clear? So the remaining things we will discuss in the next lecture. Thank you.